time for our weekly checkup with Dr. Hong.
Today, you're going to talk to us about OCDs, obsessive-compulsive disorders, and actually they're quite common because I think from time to time we've all done it a little bit.
Right, and that means you have obsessive-compulsive traits. Guilty! I definitely have OCD traits. People say, you're so anally retentive, and be like, yeah, I know, I worry, and I make sure that everything I do is correct and 100%, but that's the way I was trained, I guess you could say. But when is it gone too far? And that's what obsessive-compulsive disorder is, OCD, is that the obsession is an unwanted thought. It's an unwelcome thought. The people with OCD don't want this thought, but it intrudes into their thoughts. So they worry, and to relieve the worrying, they do a compulsive behavior. So, for example, some of the obsessive thoughts that people have will be like, oh, well, gosh, I'm going to worry if I forget to do something, it's going to be disastrous, so I better check the doors locked 8, 9, 10 times because I'm sure that something bad will happen if I don't worry enough about it. Some people actually have aggressive impulses and they believe they're going to hurt someone. They would never do it, but that intrusive thought is always there and they can't get these thoughts out of their head, such as fearing someone will be harmed like a loved one. They worry to death about that. Howard Hughes may have had OCD because he had the fear of germs and dirt, so they're always washing their hands, trying to get things, stay away from being dirty or contaminated. Also a fear of chaos, so people, they line their pencils all up in a row and everything, the feng shui, so to speak, has to be perfect every time. So, to deal with that are the compulsive behaviors, such as people count. They may count all the little tiles on the floor, or they're constantly arranging things, as I mentioned. Hand washing, and our Purell nation now, everyone's always decontaminating their hands, and it's just quite fascinating to me. Also, some people may pick their skin and bite their nails, so people can actually pull all their hair out and have bald spots, and it can be quite humiliating. So people who have OCD tend not to see the doctor because there's a certain shame about it. But, well, now that there's more information about OCD, I think that people are going to be starting to talk about it more. They have that show, Monk. Isn't that about an OCD guy?
And even Jack Nicholson, and As Good as It Gets,
yes,
that's a prime
I know.
example.
Yeah, he wouldn't step on a crack because he would break his mother's back.
Yeah, something like
whatever that means.
So you should see your doctor? Or?
Yes, see your doctor.
Okay.
And also cognitive behavioral therapy can be quite effective along with medications.
All right, thank you.